Hi, good afternoon. My name is Eliany Mejia, and I'm one of the EP Fellows at University of Virginia, and we are here at ACC 2019 at the FITsontheGo, and I have with me Dr. Pamela Mason. She's actually our Program Director at the University of Virginia, and she's also the Electrophysiology Lab Director, and for me it's an honor to have you with us here, and I have a lot of interest in knowing your opinion, especially for me as a woman fellow in cardiology. I have to say that I stay at UVA because I have good role models like you, women in cardiology and in interventional procedures. So I just want to hear from you. What is the approach? What is the program director approach? How you can engage more women into cardiology? Because we need to get more of us here. So I would like to hear from you.
Yeah, increasingly we're recognizing that it's a huge problem that there aren't enough women, or minorities for that matter, in cardiology. Right now, if you actually look at the numbers, if you look at internal medicine residency, it's almost 50% women. But yet in cardiology, it's less than 20% women and less than 20% fellows coming into training. And it's a huge issue. And I think that there's a couple issues that need to be addressed. One that's being addressed well is we're actually getting more data. We're increasingly recognizing that having women in cardiology isn't just good for the women in cardiology, it's good for patients. The patients, especially our female patients, get better care if they're cared for by women cardiologists or by men who have women colleagues. And so it's good for patients. It's not just good for the women who are going into cardiology. And having that data helps change the culture. I think the key thing is there's that old adage, if you can see it, you can be it, right? It's hard for women internal medicine residents to see how they can be cardiologists if they don't see any female cardiologists. And the ACC really can be on the forefront of this, and really is, by helping to engage with mentorship for maybe trainees who don't have a female mentor or role model at their institution, and they can help see other people from the societies.
Yeah. So that is exactly the point. Like for me especially, I went into cardiology because we had really good role models in our area. The other thing is, having more role models required to get more fellows into EP and then eventually more, attendant supervising positions. What are your thoughts about interventional subspecialty? We're talking about both interventional cardiology and also EP. I'm an EP fellow and I'm really happy being an EP fellow and I'm in love with the field, but I know a lot of fellows that are just, coming into the cardiology world that they have a lot of questions. They have a lot of insecurities. They have questions about radiation. They have questions about life and work balance. So what are your thoughts and what do you want to recommend for them?
As somebody who is an electrophysiologist, people ask me this question a lot. How do we get more women in electrophysiology, or interventional for that matter? I think going back to what we were talking about before, we've got to have the women in general cardiology to recruit from to get into the interventional fields. And I think that really has to be the first step. After that, again, it's the whole concept of mentoring and trying to break down these preconceived notions of, what is a good fit with work-life balance. Because those really are preconceived notions that are not entirely correct. Many of us who are in these interventional fields, not that there aren't challenges, there are, but we're finding ways to make it perfectly compatible with having a family and having a life outside of just work.
All right. Thank you so much, Dr. Mason. This has been great. So I think that for the women out there, cardiology is a beautiful field. There's a lot of different areas in cardiology when we can practice and we can have a really good life, including interventional, including electrophysiology. So it's all about role model. That's what we got from here. And thank you so much for spending this time with us here.